Hey everybody, it's Dr. Stephanie, and I told you we were going to be talking about a gastrointestinal issue that a lot of people are kind of dealing with. And I just want to give you a heads up about something that a lot of people are walking around with right now and don't kind of know it. It's relatively new, but it's not new. So some of your doctors might be aware of it, and some of them might not be. And it's just been in the office a lot this week, so I just wanted to give a little shout out, because I listen to whatever comes in, or I hear a lot in my life. I figure that's what I'm supposed to talk about. So irritable bowel syndrome, people are often really uncomfortable with it because a lot of this stuff, there's a lot of poop things happening in their lives, and that can be a lot of diarrhea, that can be a lot of constipation. It's a combination sometimes of constipation, diarrhea. So I wanted to at least kind of talk about this, and if you have it, you'll certainly know what I'm talking about. An irritable bowel syndrome is a catch-all phrase given to a tremendous amount of gastrointestinal disorders. So lots of things fall under that. It's kind of like eczema. We don't really know what's wrong with your skin, so we just call it this thing, and we have no idea what to do about it or whatever. So this is kind of related to that. So how irritable bowel syndrome came to be. It's a big catch-all phrase, and lots of other things are put in there. And the more accurate you are with what's going on, whether it's one thing, two things, three things, the better treatment you're going to have, and mitigation of those symptoms, and hopefully resolution of the whole thing. Because ultimately, I'm not allowed to say cure or certain things like that, but pretty much your body can come back from everything. There's not a single thing, pathogen, or anything on this planet that has taken everybody out. Right? We've been through Black Plague, bubonic plague, all kinds of things. So just know humans can survive anything. Otherwise, we'd all be dead, right? And that's not how it works. So we have the immune system capability to fight the biggest things. So things like gastrointestinal disorders, which are really lifestyle induced anyway, of course you can correct them. Of course your body can heal them. Change what you're doing, and your body can recover. It's really pretty simple. So all right, thought about poop and gas. I talk about this in the office all the time. We have to get our parents really comfortable. Kids are really comfortable. I'm a mother of a 12-year-old, so I hear about poop and gas 50 times a day. It's just the number of fart jokes I have to hear that are not funny is mind-numbing. Okay, and because I appreciate, good fart jokes. But here's the thing. So all irritable bowel, 60 to 84% of all irritable bowel has this thing in it. So what is it? It's small intestinal bacterial overgrowth. And I'm going to have to move to do this. I keep forgetting I've lost one of my tripods. So I have to keep modifying how I'm doing it. All right, so SIBO. That's what it means, SIBO, small intestinal bacterial overgrowth. How I want you to think about it is basically people get in the habit of saying good bacteria, bad bacteria. I just don't think any of it's good or bad, ultimately. It's really about things being in the wrong place or wrong time or wrong amounts, because we're supposed to have these pathogenic microorganisms in our large intestine. There are a lot of things that you might call bad, but they're supposed to be there because they are bad to the other things. Like really pathogenic things are there to kill the other pathogenic things, and they keep everything in check if we work with them and create a harmonious type of balance, an environment where they can just keep each other in check. But we think we're so brilliant, we just keep killing everything, and then something that wasn't opportunistic suddenly can take over and become, because there's no checks and balances in the gut anymore. But what happens with SIBO, so we're just going to look at it, I'm not saying it's bad bacteria, it's just bacteria in the wrong place. So what does that mean? I should just draw it briefly. So in the body, down here, you have this thing. Basically, I'm doing a bad job, but that's your large intestine. And it's where the poop will form, and then it comes out your butt. Okay, that's what happens. Then you have the stomach, and then you have the small intestine that's like, oh, crazy. And it eventually meets here. Okay, and then it goes here. So you have all the food comes into the stomach, and it goes all through all this craziness, small intestine, and then it comes down, and it has a little valve, it's a little doorway. It says, you can come in now, and then it goes in the large intestine. So in the small intestine, what's supposed to be happening is all the absorption of the nutrients, right? That's where the absorption of everything that feeds us and heals us is supposed to be happening. So it's a really, really long, takes a really long time to get to the large intestine. Because once you're in the large intestine, the main thing there is how you look at it physiologically is absorption of the water. Turn this liquid stuff into a solid thing, get the water back so we do not dehydrate, and then let all the bugs do what they're supposed to do. That's where all these bacteria and viruses and parasites and things are supposed to live, yeast. Things are supposed to be there. They do what they do. They make their final changes and all kinds of other things happen. But in general, pull the water out. We're not digesting anymore. That's what we're doing. All the food absorption happens up in the small intestine. So bacteria are not supposed to really be there. There's a couple things that are, but let's just basically say nothing's really supposed to be there. And if it gets in that place, we end up with something called small intestinal bacterial overgrowth. Okay, so what you need to know is the bacteria can get into the small intestine from a number of places. It can be stuff from the colon. And like I said, there's this little valve that helps it like open and close. We have a valve, a sphincter at the butt, the anal sphincter, and it stays tight so poop doesn't fall out. And when it doesn't work, poop falls out. And those are real conditions and real problems for people. It's really uncomfortable. So when this thing isn't working right, when it's stuck open or stuck closed, we have problems. So if it's open all the time or leaky, and maybe some of those bugs start creeping up and growing and things like that. You can also get it, so it can come from the colon, from some issue. The valve can have a problem. It's very common to happen after food poisoning. So food poisoning is bacterial overgrowth in the food. It gets in the stomach and small intestine. So a lot of people end up with these symptoms after a food poisoning incident and don't make that connection. Also, like other places, there are lots of other ways that can happen. Sinuses, like chronic sinus infections, if you're draining into your throat, like if this is going on for a long time, it can eventually keep getting itself into the stomach every single night, and then they grow and they end up growing into the small intestine. So when we're correcting, when I get to how do you correct this, knowing what was the cause is very helpful, because you can keep trying to deal with it and kill everything and balance it. But if you still have this major valve problem and it's always going up, it's always going to come back. If it's coming from food poisoning, you keep eating at the same place every 3 months and you get food poisoning all the time, subtly, you're going to keep infecting yourself. So if it's that, you better deal with it, okay? That's just the point. Okay, so I kind of said some of this already. What is supposed to happen in the small intestine? You absorb nutrients, okay? If you have SIBO, your digestion is not as good. You're increasing damage to the intestinal lining. This is why it's happened. So the absorption of nutrients is really down. This is why anemia and B12 issues, all these other health issues happen, because we can't get stuff in. What's really happening is these bacteria are in there and they're not supposed to be there, and they're digesting food. And what they do is turn it into gas, lots of gas, and fermentation is happening. The main thing that they're doing that with are fruits and vegetables. I'm going to say sugars. So you have the sugars, the starches, especially fructose. So even something you would think as benign as honey is now making you sick. The xylitols and maltitol causing a big problem. They're massive food sources for this bacteria. And so if you're somebody who ends up feeling gassy, bloated, full all the time, seems like you're eating healthy, if you're going vegetarian or vegan or raw and everything's getting worse, you need to start looking at all this, because part of the treatment is diet modification and it's eliminating those foods. But this is what's happening. You end up with damage to the lining of the small intestine because, again, an activity is happening in there that should not be happening. So you often see many absorption issues, failure to thrive issues, thin, can't put on muscle mass, very anemic looking, weak. People always want to diagnose methylation problems, and it might not, like give all these B vitamins. Like, you might not have a methylation problem, you may just have a massive absorption problem. And if your therapies and supplements and all these things are not working, it's probably something like this that's making it be a problem. Okay. All right. So, yeah, kind of said some of this. So what's happening in SIBO? We have a massive increase in gas production from eating certain foods. And also you end up with a fat digestion problem. So you end up low in the vitamins A, D, E, and K, the fat-soluble vitamins. Because there's all this chronic damage to the lining, food is getting absorbed into the blood in the small intestine instead of what's supposed to be. So these smaller subparticles, now you get these big holes punched through. That leads to like food allergies and sensitivities. So you're not really supposed to be allergic or sensitive to 27 foods or even 4. So the validity of some of that testing, you can get results by stopping eating all those when you spend all that money on those tests, but I don't even do that anymore clinically because I feel like I can use people's money in a much better way, because overall, you're really not allergic. You have damage. Let's just heal the damage and remove the things, and you can slowly introduce the things and save yourself thousands of dollars personally. I think it's clinically more efficient, but we can test if you need to. But that's what's really happening. So you're going to test positive. It's not like you have to avoid these foods for life. You need to heal the problem, okay? There's often a lot of pain. We see the symptoms a lot in things that people may not suspect. That causes a lot of, not just gastrointestinal problems, can cause a lot of physical body pains and joint pains. So you see fibromyalgia, asthma, I believe that's a big one. But neurological stuff, anxiety, depression, autism, ADHD, lots of brain fog issues. GERD, the reflux is an issue. So think about it like, you have that abdominal space. You only have so much space, in here, right? And if I'm filling all this gas, and it wants to come out this way, it wants to come out the other way. The large intestine gas, we do fart it out. Small intestine, it's harder for that to come out. It's very confused. It's not supposed to be there. And especially, again, it's fruits and vegetables that are the problem. Certain ones in particular as well. Meats and fats typically aren't. Again, you might have a fatty acid metabolism problem a little bit because things aren't going well, but usually it's protein. You're good to go while you're dealing with this. And if you eat something else, you get sick. You're like, what is going on with my gut? And it's probably this. So, and again, I'm going to review. In irritable bowel syndrome, 60 to 84% actually have SIBO. And it's not getting caught, it seems. Or I'm not sure. I guess it's a newer kind of thing for gastroenterologists to be dealing with. All right, so SIBO part of why they're not catching it is because it is hard to test. There's been some controversy on how you do it, because basically the gold standard is to aspirate the gas. So it's like a surgical procedure. And who wants to do that? So they've been working on testing that's accurate, and that's tough in medicine. Sometimes testing is a hard thing. What works, what doesn't work. Where we're at with like what's clinically easy are these breath tests. Again, but it's like 3 hours of blowing air and collecting it in vials and shipping that off. So for some of us with children, that's not easy. And with autistic children and non-compliant children, I mean, good luck with this, right? So we use a couple tests in my office. We use the organic acids test, use it for a number of things. It's urine, it's easier to get. Stool analysis, easier to get. And you can kind of extrapolate from that information what you think is going on in the large and the small intestine, from the metabolites and the volume of things. And if we feel like we need to refer out for another test, we can do that. But this is what I do. But in general, I'm going to send somebody out, they're going to get this. Or a very good functional physician, or very good GI person can absolutely tell, sometimes there's clinical signs and symptoms and physical exam, palpation. I can palpate, there's certain things you can kind of tell that, like, yeah, we're on a really high probability that's what it is. They can do it sometimes without the test and be very, very accurate. But it's just, I want you guys to be aware of it so you can go to your doctor if you feel like this sounds like me and I need to like look into it, okay? Or my kids. All right, so treatment has a few prongs to it. One, you need to find out what's the cause, okay? Is it, like I said, is it a structural problem? Is it coming from the sinuses? Is it just happened, you just gotta deal with it, and you don't have to keep dealing with the cause. You always wanna go to the source. But it does require food restriction. It requires a change in diet for at least 2 to 6 weeks. Usually we're gonna need about 2 months. And popular one people can look up is FODMAPs. It'll give you an idea of what that is. But some people, specific carbohydrate and keto. Again, it is why so many people, when they go keto, which is a ketogenic diet, is instigating your body to make ketones for energy instead of glucose. So it's very low carb, moderate protein, and moderate to high fat, depending on your physiology. So they're not eating the foods, they're not eating sugars, right? They're eating simple, no fructose, and they can have massive improvement in gastrointestinal issues, and when they eat something, have a massive explosion of symptoms, and they think it's all about eating keto. It's like, no, you actually have a gut problem and you need to address it. Because trying to starve the bugs, that's what you're doing with the food. Just the food alone, the chances of you starving them and getting the whole thing balanced is incredibly low, okay? So you're gonna have to take some other things. I prefer practitioners that are using herbs and that know what they're doing. So you would have herbs to kill the bacteria and herbs that are also going to kill the biotoxins, because they basically put a, like I just said, so there's a biofilm on our teeth, so the bacteria in our mouth make a biofilm. And so that stuff you'll feel like in the morning, that's a biofilm. They're protecting themselves and they're encasing themselves in something that the other herbs can't normally get. And so you need to have a practitioner who knows what they're doing to do that. So you have to restrict the food, eliminate certain things. Again, it's mostly carbs and certain, like, it's stuff you think is good for you. Apples, mangoes, watermelon, honey, xylitol, people, fake things, all kinds of cauliflower, broccoli, asparagus. Yeah, so again, one man's food is another man's poison. Everybody needs to remember that. This one size fits all crap is ridiculous. So you need to know your body, what's good for you right now. When this is all done, knock yourself out with asparagus again, right? Asparagus is good. It's not like it's going to cause you to have SIBO. That's not what caused the problem. Okay, I want you to be clear on that. Apples didn't give you SIBO or anything like that. They're just feeding the bugs because they're in the wrong place. So you're going to have somebody who knows what they're doing with this, and possibly specific medications, antibiotics. There are some very specific ones that will stay in the gut, and they think even can stay in the small intestine and not wipe out your large intestine. A lot of clinicians are just like bombing people with antibiotics. I've seen just unbelievable 6 months of multiple antibiotics that I think just, you really need somebody who knows what they're doing, and I think would take this approach first. And we certainly, then you're going to retest. So you have to do all these prongs. It is one of these harder ones to manage, and it can recur again if you don't really stay on top of it. So let's say, again, it's coming from a valve problem and you've gone for 6 months, it's going to come back and come back unless you have somebody close the valve. And visceral chiropractors like myself can do that for you. So what else? That's about it. And another big part of the whole treatment, what ends up kind of happening overall in this disorder is that the motility of the gut gets messed up, and so increasing that motility again becomes a really big paramount thing. This is not the end all be all. There's a lot to SIBO. Go ahead. There's so many things on YouTube, really good lectures, Autism 1 lectures. Lots of people talk about SIBO there because it's really, really common in children that have had that have neurological damage, because they have so much gut damage. That is probably one of the reasons they have so many neurological damage. The stuff is going in and affecting your brain. So it's why I have to do so much gut stuff, because I do so much brain stuff, and they're very related. So I want to let you know that might be what's going on with you, that it's the missing piece as to why you're doing something that's just not working. I've had patients say, oh, I tried FODMAPs for like 4 weeks and nothing happened, but they didn't do these other things. Like you weren't actually doing a whole lot. So just think about that. Gas, pain, bloating. If you're definitely getting bigger as the day goes on, very likely this. Let me see a question. What if you're a vegan and these veggies are a big part? Then you have a problem. You're going to have to change that. If you have SIBO, you can't eat those vegetables, or you're going to continue to have that problem. Your diet, you're going to have to try new foods. But again, you need to get a physical exam and do the test. If you have these signs and symptoms that correlate with it, it's harder. It is certainly harder. I was a vegan for 12 years, vegetarian for 14, and I'm not anymore. And you really are going to have to listen to your doctors. It took me 5 or 6 doctors over many years telling me to stop doing what I was doing, because I was getting sicker and sicker and sicker, and I had tons of these problems. And correcting things, it's not impossible. You can do it, but you're going to have to do a FODMAPs vegan-based diet then. But in general, what helps with this is a lot of proteins and fats that are very, very hard to correct with SIBO without that. All right, any more questions coming in? Otherwise, I'm going to get going. So if you guys got something, type them in for you. But yeah, look that one up for the vegans and see. There's a lot you can't eat. You just have to even explore your diet more. Please tell me again, what is the first step? Should I seek your assistance? No, I would say, if you have these signs and symptoms, I would go to your physician and who can hopefully get you to the right gastro. I certainly, if someone is in Atlanta, we can run the oat and stuff. I refer SIBO out most of the time because I don't have the time to manage everything. I monitor. I usually am catching it. I have a good couple physicians that I use and refer to, and I can trust to, I know they're going to do it like this. So, but I see people coming in and it's not so good. But I would go for you, Paul. I would go to your primary person. There might be a great naturopath. There might be a great chiropractor who specializes in this. I don't specialize in this. I just happen to have to do so much gut stuff at the same time. So what else we got? Anybody? Any questions? Because I'm going to go. You can ask me about your poop and your farts and the things. I talk about it all the time. That's what I like to do. Okay. I'm going to go. No questions. Have a good Sunday, guys. I think it's full moon tonight. I was supposed to go to a full moon ceremony, but I was in my stuff. So you're welcome, Fatima. Yeah. So I guess that's be the first thing. With you, Paul, if you want to reach out, if you're here in Atlanta, totally. L-glutamate. Yeah, so I don't recommend L-glutamate at all anymore for the gut. That's really old school, Jeff, actually, because it's a neurotoxin. It causes a lot of excitotoxicity in the brain. I used to do that. Everybody used to do that in the autism community, and the ones we've learned better and we've backed that off. I will use it very occasionally, but it gets into the brain and causes a lot of issues. So I stay away from it now. I can deal with the gut healing so much better. And L-glutamate is going to do nothing with SIBO. So it's not what we want to do with it. Any more? Okay. See, I said no, and then more one came, so now I'm hesitant. My mouse is not, most definitely every tattoo. Yeah, it might be. It's just really sad. I don't know. People in Atlanta ask me for a good gastro. I don't have a good gastro here, just so you know. I refer to a couple physicians. They're concierge, though. Typically, you have to pay a monthly fee, and some of them are a little hard to get into, but they're good. And so I want to refer people that I know that are good and that will work with me and that have been into my office, that will talk to me, that will, that are all about taking care of their people and have no ego threat of some other doctor trying to help, especially one that doesn't carry an MD and they have no issue. They're good people. So, all right, guys, I'm going to go. Happy Sunday. Happy full moon. Go chant, go meditate. Look at your poop. Is it fatty? Because your doctor's going to need to know how many, how often, does it hurt? I ask these questions. People are I don't know. How do you not know what if you poop today? Right? See ya.